My name is Kayla O'Connell, and today I will be instructing the use of diagnostic ultrasound for evaluation of the neurovascular structures of the femoral triangle, including the femoral artery, femoral vein, and femoral nerve. The femoral triangle is located at the proximal aspect of the thigh. The borders of the femoral triangle are created by the inguinal ligament superiorly, sartorius muscle laterally, and adductor longus muscle medially. The floor of the femoral triangle is made up of the pectineus on the medial aspect and the iliopsoas on the lateral aspect. Of interest, the femoral triangle contains the femoral nerve, artery, and vein. Anatomically, the vein is positioned medially, artery between the vein and the nerve, and the femoral nerve positioned laterally. One can remember the anatomical alignment with the mnemonic minivan, where the M in mini stands for medial and van orienting the position of each content working medial to lateral. This axial view allows for visualization of the floor of the femoral triangle with the neurovascular contents above. The image on the left depicts the round circular appearance of the femoral artery in the center. To the left of the artery is the femoral nerve, identifiable by the honeycomb appearance. The image on the right depicts the round circular appearance of the artery with the flattened oval-shaped appearance of the femoral vein, which sits to the medial aspect of the femoral triangle. When preparing a diagnostic ultrasound evaluation, the patient will lay supine with the hip externally rotated in a frog leg position. Once the patient is in this position, the skin should be exposed while appropriately draping the patient to maintain privacy. Once the patient is in position and appropriately draped, the examiner will prep the area with gel. The linear transducer will be positioned on a transverse axis, with the indicator on the left of the examiner to match the monitor screen orientation. The examiner will move the transducer along the medial aspect of the femoral triangle to identify the femoral artery by a distinct circular figure, which can further be identified with slight pressure. Once the artery is located, the examiner can change the settings to further identify the femoral vein to the medial aspect and the femoral nerve to the lateral aspect of the artery. This video depicts the distinct identification of the femoral artery by viewing the pulsating feature of the blood flow. The examiner can place slight pressure on the patient, then release, looking for pulsating within the image. The artery will pulsate due to the arterial blood flow pressure, whereas the vein will remain still, depicted by the red and blue arrows respectively.